Hi guys, my name is Kaylee Morgan, soon to be RN from SF State's entry-level Masters of Nursing Accelerated Program. I'm excited to be here, and today I'm going to teach you how to properly change a gunshot wound dressing and how to properly care for a gunshot wound. So according to the SF Gate, roughly 115,000 people are injured by gun violence every year. Zuckerberg SF General Hospital treated 189 of those people for gunshot wounds, and 31 of them died from their injuries from last year alone. So if you work in a rural area or an urban area, the ED or an ortho unit, chances are you're likely to treat a gunshot wound at some point in your career. And I'm going to show you how. Let's get started. So the equipment we're going to need today are a pair of gloves, a couple saline flushes, a couple 2x2s and 4x4 gauze, zero form, can you see? And Kerlix, which is a sterile wound dressing, scissors, some Metapore tape, and it's optional depending on the wound if you need a basin or a clean towel or washcloth. So like I said, of course, the type and frequency of the wound care depends on the severity of the gunshot wound. So for the purpose of this demonstration and education video, I will be performing wound irrigation and dressing change for a gunshot wound that's about 4 to 5 days post-op. So you also want to keep in mind before we get started that you'll be charting everything that you're doing, as always. So you're going to want to chart an assessment before and after the wound irrigation procedure. So this includes the amount, color, and drainage and odor of the drainage on the dressing that's been removed, the amount and type of solution that was used to clean the wound, the irrigation device used to clean the wound, the overall tolerance, the patient's tolerance of the procedure, and the type of dressing that's being applied. So before we get started, of course, you're going to want to do your hand hygiene, verify your patient with 2 identifiers, and position the patient's bed at a height that's not only suitable for you, but that promotes wound drainage. So typically, you would want the wound vertical over the basin or the chuck or towel that you have. And also, depending on the patient's pain tolerance and response to wound care in general, you may administer an analgesic about 30 to 45 minutes before the wound irrigation procedure because it can be a little uncomfortable. Okay, so first, after we've identified the patient, performed hygiene, we're going to put our gloves on, and you're going to remove the old dressings. You can use the scissors to remove the old dressings if it's easier, or you can unravel it. Typically, they're wrapped in Kerlix or some sort of bandage, especially if it's on a limb. So I'm going to be performing a gunshot wound irrigation procedure, just an example on my own arm. So let's get started. So like I said, I removed the dressing. I noted in my mind or made notes of the amount, odor, and color of the drainage on the dressing. And then next, I'm going to use a 10 ml saline flush. And just literally just clean the wound like so. You want to make sure you get all of the wound covered in the saline and that it's promoting drainage. Okay, and this is up to you, and again, depending on the type of wound or how deep the gunshot wound is, you can either let it air dry or use the clean cloth to pat dry around the wound. You can also use the 2x2 gauze to dry it, but for now we'll just let it air dry, okay? Again, you want to keep the saline syringe about an inch above the wound and at an angle. I know there's different types of wound irrigation. Sterile wound, you may have to put the catheter inside the wound, depending if it's a deep wound with a narrow opening. So this is just pretty superficial, but we're still just going to make it at an angle about an inch above the wound, okay? So now it's air dried, and then we're gonna use our Zeroform to promote wound healing. So Zeroform is a non-adherent sterile wound dressing. It's less painful and it minimizes the trauma to the actual wound. Typically, people will use this for first and second degree burns, surgical incisions, lacerations, skin grafts. So you may see that, on the burn unit because it conforms to the body. So essentially, the Zeroform is an occlusive dressing, so it prevents air from reaching the gunshot wound, and it promotes a moist healing environment. So because it retains moisture and heat, and it helps the medication like bacitracin or Neosporin stay in place, this is the best dressing that you want to use. It's made of absorbent fine mesh gauze that's been soaked in a 3% bismuth tribromophenate petroleum blend formula. So it provides a bacteriostatic protection, conforms to the body, and it's very comfortable and soothing for the wound and the patient. So it's definitely what you want to use. So we'll go ahead and open it up. So specifically for gunshot wounds, you want to make sure that you have your Zeroform as closely cut around the wound as possible. You don't want the Zeroform on the good skin around the wound because it will make it moist and jeopardize the integrity of the good skin. So you want to just make sure that it's on the actual wound and no further out around the perimeters, okay? So we're just going to take our scissors, and this is what the Zeroform looks like, okay? So we're going to take our scissors and just cut off a piece up here. So it's a little sticky because of the bismuth triphosphate. But of course, these have been washed in rubbing alcohol and they're sterile. So we're gonna just assume that that's clean. And again, we're gonna cut it so it's just over the GSW, okay? So you literally can just, after I saline here, this is my fake gunshot, I'm gonna put it right here. Okay? So it's not covering any other thing but the actual wound, okay? Then to ensure that it stays in place, especially if it's on a limb or a ligament that the patient's gonna be using actively or moving around, you don't want the dressing to come undone. So we can place either a 2x2 or a 4x4, depending if it's bigger or if there's multiple gunshot wounds next to each other. You can place it right here, okay? And then what you're gonna wanna do is use acrylics. So this is a sterile sterile gauze Acrylics bandage roll. So this ensures the wound dressing placement, that it won't move around or get out of place. Let me try and open it. And as you can see, I'm sure you guys have all used this before in the hospital. It's really pliable and it's really soft, so it's very comfortable for the patient when they want to move around. So you're literally just going to wrap it around the limb. Okay. A little hard to do on yourself. You just want to keep wrapping and wrapping two or three times around to make sure that it's secure, okay? And now at the end, it kind of depends on you and what you want to do and the activity of your patient. But you can use a piece of Metapor tape to secure the Acrylics to the other part of the dressing, so it doesn't move around. Okay? So I can just use some of my little tape here. And sometimes too, you can secure the little 2x2 or 4x4 piece of gauze that's underneath the Acrylics with a piece of Metapor tape as well. Typically, again, it depends on the gunshot wound and the severity of it, but you'll want to change this dressing every 2 to 3 days, or if there's any drainage coming out, you want to make sure that this stays clean for the integrity of the limb. Okay? So we're all done with the actual wound change dressing. So a couple more things is that, again, typically with Zeroform, you're going to want to change it every day because it's a moist, like you can see, it's a very moist dressing that you'll want to change every day so that they can promote better skin healing. If that's not feasible, every other day is okay. Typically, like I said, it's every 3 to 4 days that you're going to do a gunshot wound dressing change. But again, it is all depending on the physician's orders and the type and severity of the actual wound. So again, just a reminder, you're going to want to chart the amount and type of solution used. So we used just a 10 ml normal saline solution, and the irrigation device, just this little syringe. The patient's tolerance, I handled it very well, thank you. And you're going to want to use, you're going to want to chart the type of dressing that was used to replace the dressing on before. So like we said, we use Zeroform, this awesome dressing, and Curlix. So it's sterile and it's clean and it promotes proper wound healing. Again, I just want to emphasize that Zeroform shouldn't be used on infected wounds. It's only beneficial on uninfected healing wounds. So don't use it on infected wounds, and also educate your patient on the signs and symptoms of an infection. So if there's any redness, more drainage, or swelling, itching, that sort of sharp increases of pain, you're going to want to immediately notify the healthcare provider, the attending healthcare provider, as far as what to do next. That is about it for today. I hope you guys learned something new. I know it's pretty basic, but I didn't know that Zeroform would be used for gunshot wounds. I knew for burns and things like that, but it's always beneficial to know how to treat these things. And unfortunately, we will most likely come across it in our career. It's a skill that's useful, but we hope to never use. Thanks for watching. Have a good one.